You've been told you have a head or neck tumor, and surgery is one of the options being discussed. Head and neck tumor surgery removes growths between the collarbones and skull base, sparing the brain, eyes, and spinal cord. Tumors can arise in the mouth, throat, voice box, sinuses, salivary glands, thyroid, or neck lymph nodes. A multidisciplinary team reviews imaging, biopsy results, and overall health to decide if surgery is the right approach. The main goal is removing the tumor with a rim of healthy tissue called a clear margin around it. Modern approaches include transoral robotic surgery, endoscopic techniques through the nose, and minimally invasive laser microsurgery. Nearby neck lymph nodes are often removed in the same operation through a selective neck dissection. When tissue is removed, reconstruction rebuilds shape and function, sometimes using skin, bone, or muscle from the arm or leg. A temporary breathing tube in the neck, called a tracheostomy, may be placed to keep the airway safe during early recovery. Hospital stays range from a couple of days for small operations to about 2 weeks after major reconstruction. A speech and swallowing therapist helps rebuild safe eating and clear communication after surgery. Depending on final pathology, radiation or chemoradiation may be recommended after surgery to lower recurrence risk. Follow-up visits are frequent in the first 2 years, when most recurrences occur, then gradually spaced further apart. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.